Welcome, everyone. Thank you all for joining us. My words already are broken today. We're going to get started here in just a moment, right at 2:00. I hope you guys are having a fabulous day. And if you're, yeah, no problem, Kay. Thanks for joining us. And so Kay just put something in the chat. Feel free if you have any questions, use the chat, and we will likely answer a lot of your questions throughout the presentation. But if we don't, then we are going to have a little Q&A at the end, and we'll answer as many questions as we possibly can. And we're here for you guys. So still have a few people joining. Just to give like another minute for folks to jump in, how about we give away some money? Money's good. I'm sorry, I'm just going to close out this Teams thing that our team keeps messaging me like they don't know that we're on a webinar right now. All right, so I'm going to share my screen and let's try this. We built this little randomizer. Let's see if it works. I hope it does. If not, then that's going to be embarrassing. But I put all of your names in here, and I'm trying to cover up the names for privacy. That's a cool way to say it. It makes you sound really smart if you say privacy. All right. So anyone who had joined in up until the last 10 minutes when I built this thing, we're going to spin this wheel. If it works. Oh, that's the wrong thing. We're going to do it. We're going to give away a $25 gift card. And we're going to do this a few times throughout the presentation because we want you to stick around through the whole thing too. So we're going to dangle $25 gift cards. We'll give a few away during the presentation to Longhorn or Carrabba's, Outback. I don't know. There's a few different locations that you can go. Anyway, let's spin it. Your name should be in here if this works. I hope it does. And I'm going to go ahead and warn you. There's a little bit of suspense in this wheel. So don't get too excited too quickly because it kind of slow rolls you a little bit. Here we go. Here's our first winner. $25 coming up. We should change this up a little bit. Keone Tyhook. He's an employee, so we'll give him one anyway, but I'm going to spin it one more time. Let's see who's going to win $25. Brett and I did a Super Bowl live stream, and we were giving away money, and we wanted a little more suspense, so we built the code, and it is really suspense. Tom Mulligan, you're the first winner on the Wheel of 64 Fortune. All right, let's get back to the show, guys. Tom Mulligan, you're a winner. All right, thank you so much for joining us. We have 64 people. Would you believe it? 67. Sorry, my glasses. Hopefully we'll have more joining, 68, 69. So I'm Chip Lewis. I am the founder and CEO of 64 Insurance Group. And this is my right-hand man, Brett Eure. He is the knowledge machine. So if you ask me a super tricky question and I'm stumped, that's when I say, hey, Brett, why don't you take this one? So I'll probably defer that to him because he's my guy and he'll be able to answer. I almost wanted to do this, Brett, like stump Brett. Can you stump Brett? But I feel like people will use ChatGPT and try to stump you, and that could put you in an awkward spot. Anyway, okay, guys, we're going to get started right now. Let me pull up my presentation. Before I do that, I just want to show you a couple of ways that you can escape us, but still be able to find us if you need to or if you want to. Let me go back here to the Wheel of Fun. All right, so here's our website, reu64.com, AREYOU64.com. If you need to leave for whatever reason, you can always come back to our website, you can click schedule a consultation. We have multiple locations across the Southeast. A couple that aren't showing up here: Columbia, South Carolina, actually Albemarle, North Carolina, and Oshkosh, Wisconsin, believe it or not. You can schedule an appointment with us, and we'd love to help you wherever you are. But mostly everyone's going to be in the Southeast here on this webinar. So if you need to, you can go to our website, you can look around, you can download our book that we wrote. It's pretty easy read. Also, the last webinar, this is a 2024 webinar. We'll update this with this. This is our first webinar of the year, so thanks for being a part of it. There are new updated numbers. And so, yeah, if you need to escape, you can go to the website and still be able to find us later if you need to. But hopefully you stick around throughout the presentation. Now let me get to the slideshow. And let's get this party started. All right. All right. Slideshow. All right, Brett, can we see that? Everything good? All right, good deal. Again, I'm Chip Lewis, 64 Insurance Group. We've been in business for about 17 years, helping folks transition to Medicare. We know how confusing and stressful it can be, but I promise you, at the end of this webinar, you will feel more comfortable. I promise you that. Stick around, and I hope that you learned something during this webinar, and I believe you will, because I know how confusing it can be. All right, so one trivia question really quick. Again, usually we are breaking the ice with this, but really the reason I want to ask this is because I want you to find that chat feature. It's usually at the bottom of your screen or the top, and ask any questions that you might have. And again, we'll answer them throughout the presentation and then also at the end as well. But how much was a gallon of gas in 1979? We picked 1979 because you guys were mostly likely around the age of 18 then, and actually could use gas or buy gas or had a car. So how much was a gallon of gas in 1979? Type your answer in the chat box, and we'll give you a $25 gift card if you're the closest one. We were giving away t-shirts for a while, but it seemed to be a really big pain to be able to get them mailed or coordinate or whatever else. So we can email you a gift card. But we have any answers popping up in there, Brett? Oh yeah, we got some good answers.
A lot of good answers. Looks like we've got a couple people that hit it right on.
Somebody said what location? All right, we're gonna stop it in like 5, 4, 3, 2, 1. All right, no more answers because everybody's 64. 86 cents, Linda Allen. I know that you Googled that. I can tell. Maybe not, or maybe you just have a really good memory. I see the ... before 86 cents. All right, good answer there. So whoever, Kim, can you see who the...
Don, I see.
If you tied...
Chip as well, and Linda.
All right, we'll do some sort of randomizer if you tied. The next one was, we're going to skip this so we can get to the show here. If you cared, it was the most popular car in 1979 was the Oldsmobile Cutlass. How much did it cost? $5,600. We're going to get on with the show. We did have some feedback before that said, y'all are messing around too much. Get to the meat and potatoes of the whole thing. So I'm listening. You talk, I listen. Okay, guys. So we're putting on this Medicare 101 webinar for free, right? If I were you, I would be asking why. Why is this guy doing this? What's in it for him? Like, there's always a catch, right? And so I don't blame you for thinking that if you are, but let me try to explain why us and why we're putting this on for free. And I put those quotes up there. I shouldn't even done it because it is free. I'm not charging you anything to be on here. So we are an insurance brokerage. And we've been in business for 17 years now, since 2009. Gosh, that's 17 years. That's wild. We've been in business for 17 years, and we're a brokerage, which means we are contracted with all the major insurance carriers out there, like United Healthcare, Aetna, Humana, and so forth. And ultimately, when you transition to Medicare, you are going to have to choose one of these carriers to administer your drug plan or Medicare Advantage plan or Medicare supplement. And so, by us being contracted with each of these carriers, then you're able to use us to shop those different plans. We're able to shop all of them. Your price doesn't go up because you go through us. You do not pay us anything for our service. We are paid by that insurance carrier if we help you get the plan. So it's a win-win for us. Selfishly, we want you on the best plan, because if we put you on the second best option, you're going to leave us. So we have bills too, and we are paid, but it's just not by you. So it's kind of a cool relationship, and one that keeps it unbiased and transparent for you. And so it's been a nice business for us, and we love helping folks. We've got an awesome team, again, across the Southeast. We have local offices. This is something that's unique. I know if you're 64 years old, you are getting bombarded. Your mailbox is full of advertisements. You're seeing Facebook ads. Maybe you see some of ours. But what we pride ourselves on is we do have local offices where you can come in, you can track us down. If you go with one of these random agencies across the US and they sell you something, it's really hard to find them. Also, if you go straight to an insurance carrier, like say you called up Humana and said, hey, give me the best plan. Well, they'll help you enroll into a plan, but then when open enrollment comes the next year, if you were to call Humana and say, hey, are y'all still the best? They're going to say, of course we're still the best. But for us, we may pivot you to another carrier each year, depending on your finances, your doctors, your drugs, all of that. We take everything into account. We pride ourselves on not pressuring anyone. Look, we love people to call us, to want to work with us. We are not going to spam you and call you over and over again and text you all the time. That's just not how we operate. We want to work with people who want to work with us. And again, there's no fee for our service. So what's the catch? There's no catch. We have a business that helps people, and it just so happens that it also is beneficial for you to use us because we can shop various carriers. All right, got that out the way. Hopefully you stick around. Here's some of our beautiful people. Beautiful people. I always go to Nathan. He looks like he just got off The Bachelor. Looks like The Bachelor. That's my little brother, Chasen. He's in our Savannah office. He's a good guy. There's Brett. We need to get some HD pictures of us. Maybe we don't. I don't know. All right, so what are we covering today? We're going to cover all the things that you want to know. Premiums, deductibles, coinsurance, how to avoid penalties. I know that's scary. Don't worry. We're going to walk you through how to avoid penalties. Should you even transition to Medicare? Can you keep your employer coverage? When and how should you apply for Medicare? There were a few changes to Part D. It was actually 2025, kind of into 2026. We'll cover those briefly. And then the biggie, probably the one that most of you guys want to know. Should I go Medicare Advantage or Medicare Supplement? We'll cover the pros and cons of each. And just keep this in the back of your mind. Everybody's situation is unique and different. There's no cookie cutter answer here. So we're going to give you a broad overview, but we highly recommend that you schedule a one-on-one consultation with us, and we can dive into your situation with your doctors, your prescriptions, and really tailor a plan to fit your needs. So every situation is unique, and we will have a Q&A after we get done here. What is Medicare? It is federal health insurance for folks that are 65 and older for the most part. Some people can get Medicare if they are under 65 with disabilities. And it was started by President Johnson, signed into law back in 1965. Have you seen that documentary, Brett? It's like LBJ on Netflix. What's his name? Woody Harrelson? Is that the one? Am I
I
mixing
don't
up my
know.
stuff
I'll have
there?
to add it
Has
to my
anybody else seen
list.
that? Drop it in the chat if you've seen that documentary. I think it's LBJ, right? I wasn't alive. So forgive me if I just totally butchered that and that's not even anyway. All right. I don't see anybody responding. So maybe everybody left. All right. So okay. I want to break this down super duper easy. I found your location in Savannah, Georgia. I'm calling right now. So awesome. Well, thank you so much. Jorge's going to set up an appointment. I guess we've done a good enough job. He's like, forget doing this. And by the way, not a terrible idea. If you don't want to sit here and listen to me ramble on and you want to skip it and get right to a one-on-one consultation, schedule that appointment and then you can go watch a soap opera or something and forget sticking around here with us. But you could win a $25 gift card probably coming up here soon. So maybe stick around. All right. So I'm going to try to teach this or explain this to you in is third grade terms because that's how I'd want it. And I want you to keep this in the back of your mind. Somebody said, I'm just here to win the money. That's funny. Just keep this in the back of your mind. There's a lot of things that will lead up to the ultimate decision, which is choosing between a Medicare Advantage and a Medicare supplement. 99% of people, that's what you ultimately are going to really have to choose. All the things leading up to it, applying for Medicare, should you apply, when, how, all of that, we can get you to that point. So don't stress out about that. As long as you are on our radar or under our umbrella, we can help you with all of that and then help you decide on one of these two options. But if you're going to go do this on your own completely, fine. Just keep that in the back of your mind. That's the biggie. People get caught up in all the A, B, C, D, E, F, G. Just take. It'll make more sense in just a moment. All right, so we're going to explain original Medicare. Take this with a grain of salt because original Medicare is either going to be replaced or supplemented depending on which option you go with, that Medicare Advantage or Medicare Supplement. And I promise you it'll start to make more sense here in just a moment. But original Medicare, Part A, is your hospital coverage. Hospital coverage, you do not pay a monthly premium for Part A as long as you have worked 10 years of your life. Okay, so you do not pay anything a month to have Part A. You get it for free. That's your hospital coverage. Now, I'm telling you this, and I don't want you to take notes or try to remember this piece because, again, it will most likely be eliminated or replaced. It'll make more sense in a minute. But if you were to just have Part A of Medicare, which you have earned because you've worked 10 years of your life, and you went to the hospital, you'd have a $1,700 deductible, and that'd cover you for 60 days in the hospital. I'm not going to go into all this days 1 through 60 and 61 through 90 because it likely does not matter, and I don't want to overwhelm you. So Part A is your hospital coverage, and you don't pay a monthly premium for it. And I'm sorry, I'm trying to minimize this chat box that's going down. That's all you need to know right now. Part A, hospital. You get it for free as long as you've worked 10 years of your life. Part B is your doctor's office portion of Medicare. This is your medical, and it does cost a monthly premium. $202.90 is what you will pay. Most people will pay each month to have Part B. Now, some people could pay more for Part B, and I think that's on the next slide that will break that down, depending on your income. And some people could pay less, could pay zero, depending on your income. So how does Part B work? So you have to pay a monthly premium to have Part B, and essentially it will cover you 80% at the doctor. And again, this is original Medicare. So take this also with a grain of salt. The premium matters. You're going to pay that premium even if you go with a Medicare Advantage or Medicare supplement. So that you definitely want to remember. There's a $202 monthly premium, but what happens after you pay the premium depends on these various situations. But let's say that you went with original Medicare, Part A and B only, okay? So if you have Part B and you went to the doctor's office, you'd have a $283 deductible, which means you have to pay the first $283 before Medicare Part B kicks in. Once you pay the $283, then Medicare Part B will cover 80%, leaving you responsible for 20%. I'm going to leave it at that for right now, and I'm going to start tying everything back together here in just a moment. This is an IRMA chart, income related monthly adjustment amount. And if you make over a certain threshold, if you make over $109,000, then you could pay more for your Part B premium. Okay. And I'm not going to dive too deep into this because it can get, there's so many differences in income and all of that, that if you do feel like you fall into this category, then we strongly recommend that you schedule a consultation. And so these thresholds, just to put in the back of your mind here, 109,000 if you're filing single, and 218,000 if you're filing a joint tax return. Now, they look back 2 years. So they're going to be looking at your modified adjusted gross income from 2024, which if you're asking yourself, well, hey, I'm not making 2024 money anymore, I'm retiring. Great thought if you were having it. And we can, if you retire, then we can help you appeal it because it's a life event change and we can get you down to the standard amount. But there are various levels. It keeps going up after you make a certain amount of money. And then your Part B increases with each of those levels as well. Again, schedule that consultation. It could mean that, and I didn't mention this in the beginning, but you may not need to transition to Medicare. If you have employer coverage, and we're going to get into this in a moment, it may make sense for you to stay on your employer coverage. And this is one of those scenarios that kind of may influence your decision. If you're talking to a random person that calls you from an 800 number and they say, oh, no, you need to go to Medicare because it makes sense. If they start doing some basic math with you, they probably aren't going to dive into your IRMA situation, which it could flip your decision on what you would actually want to do or what would make sense. And we pride ourselves on shooting you straight. If it makes sense for you to stay on your employer coverage, we will tell you that because we hope that you'll one day come back and work with us in the future. Most of these call centers or spam that you're getting left and right, they want to make a sale right away. So just be careful who you trust and make sure that they're reputable and have a track record. And hopefully you can see that we do from our reviews and references and referrals and word of mouth and all the things. Okay, here's a confusing slide for you. Maybe not confusing for you if I do a good job of explaining it. Part A and Part B enrollment. Who should enroll? Okay, I'm going to break this into a couple of buckets that might help you. Part A, remember Part A is your hospital coverage, and you're entitled to that as long as you've worked 10 years of your life. You get it for free. So whether you are going to continue working and keep your employer coverage or you're retiring or whatever the case may be, everyone should take Part A. Everyone, except one small group that might not want to. If you're contributing to an HSA, a health savings account, then you may not want to apply for Part A. I'm not going to go into that. If you're in that HSA bucket, if you do have an HSA and you are contributing, there could be some tax implications slash penalties that you definitely want to reach out to us and schedule a consultation. But so I'm going to separate the folks who have the HSA. If you are not contributing to an HSA, then you should take Part A when you turn 65. You should enroll. Okay, you should enroll into Part A. Now, there's no downside. There's only upside to Part A because you're not paying anything a month. It can't hurt you. It could only help you in a hospital scenario. Now, Part B gets a little bit trickier because if you have employer coverage that is creditable, and I'll explain more on that in just a moment. If you have employer coverage that is creditable and you're going to continue on with that employer coverage, you likely do not want to enroll into Part B because then you'll essentially be paying for uh, two different things that are doing the same thing. You're kind of double paying essentially. So you would not want to take Part B, enroll into Part B, and pay the 220. What is it now, Brett? 202.90. I don't know why I just mixed that up. 202.90. You would not want to pay that if you're still going to stick with your employer coverage. But if you do not have access to creditable coverage, and creditable coverage is if you're curious whether your employer coverage is creditable or not, it is most of the time, like 99% of the time, it is if your employer has more than 20 employees. Okay. So if you're on a very small group plan with only 5 people, it's likely not creditable. It's not always not creditable, but most of the time. I hate to speak in absolutes because we've seen a million different scenarios here. And also why we encourage you to schedule an appointment with us so we can dive into that and double check it for you. But if you do not have access to employer coverage or you do not have access to creditable health insurance, then you have to enroll into Part B or you could be penalized. And these penalties are lifetime penalties. Okay. Did I miss anything on that side? I know I see you're like answering questions, Brett. So,
Yeah, the chat's going a little crazy here.
all
I'm
right.
catching up pretty good, but and forgive me if you touched on it, but we did have a few questions about the going back to Irma, the income adjustment. I just want to make sure it's very clear that Social Security is looking at your modified adjusted gross income, or AGI if there's no tax exempt interest, from 2 years prior. So when they're looking at this, it's always 2 years prior. So just keep that in mind that your income, if you're moving to Medicare this year, your income from 2024 can serve as a baseline for how much you're going to pay to move to Medicare. And there's lots of questions about appealing that and so forth. And the federal government does understand that if you have a major life change event, such as retiring or so forth, or death of a spouse or loss of income producing property, those are life change events that you can appeal these income adjustments. So don't feel like you're stuck with it forever, but it hopefully will allow you to gauge and understand that if you pull a bunch of money out of the stock market this year, knowing you're going to move to Medicare in 2 years, it could have some negative impact. So do keep that in mind. And everyone's a little different, and that's why it's hard to tailor this, one size fits all. Everyone's a little different. So if you have specific questions to that, I would tell you to schedule so we can really uncover your unique, financial means and your timeline.
Yeah. Yeah. Good point. And I touched on it briefly, Brett, but you're right. It's like my mom. I hope she doesn't mind me saying this, but she, she has to be very cautious about how much she takes out during the year. That's on her radar to make sure she stays under the threshold. So it's something to consider to make sure that, we'll coordinate with your financial advisor to help make sure that they're on the same page. with this as well. Okay, so back to who should enroll. Who should enroll into Part A and Part B? Basically, if you do not have access to creditable coverage, you're going to need to move to Medicare. You're going to need to get Part A and Part B. If you do have access to creditable coverage, whether through your employer or through your spouse's employer, then you do not have to take Part B and you're fine. You can keep trucking along just like you've been doing, and we can get you Part B later. Okay, when should you enroll? Typically, it's 3 months prior to your birthday month. So let's say you were born in July. Let's see, June, May, April. So if you were born in July, then you would start applying April 1st, 3 months prior to your birthday month, because your Medicare will start on the first day of your birthday month. If you're born on July 15th, it would start July 1st. That's when you should start enrolling. So if you are drawing Social Security, and this is going to kind of tie into how should you enroll, but if you're drawing Social Security, you will automatically be enrolled into Part A and B. They automatically enroll you into both, and then you'll just get the card in the mail and say, "Oh wow, I'm on Medicare. Cool." That is convenient, but also know that if you don't want to keep Part B, that you have to let them know. So you have to tell them, hey, I don't want Part B because I'm still working or still have employer coverage or whatever the case may be. So just keep that in mind. If you are drawing Social Security, kind of a double-edged sword. They automatically do it for you, but if you, for some reason, don't want Part B, you have to let them know. Now, if you are not drawing Social Security, then it's shocking, and it is also job security for us. And honestly, one of the reasons why we started this company is and honestly, also, I hope that the government keeps doing a terrible job of this because it really keeps us in business. But they do not let you know. They don't send you something saying, hey, you got to do this thing. You got to enroll into Medicare or you'll be penalized for life. I guess they just depend on the massive amount of spam that you get as your reminder. I honestly think, and it's the truth. There is no way that you could miss this, honestly, with all the people just constantly calling and mailing you. So, yeah, if you're not drawing Social Security, you actually have to apply. So how do you apply? You'll do this through the Social Security Administration. We can help you apply. We help people all the time. I would, and it doesn't cost you anything. This is one of the, if I were 64 years old and had nothing to do with this business, I would absolutely say, take this off my plate, because there are a lot of nuances to it. One thing that you could go ahead and be proactive on right now, Brett preaches this all the time, is go ahead and set up a My Social Security account if you don't already have one. One of the hardest parts whenever we get to that point where we're going to help you enroll is, honestly, as silly as this may sound, it's typically you can't verify your own identity. That's sad to say, right? But you know those questions where like, which street have you not lived on? Which credit card did you maybe use one time? You know, they ask you all these questions and you get them wrong. Well, you can't guess on these things because it will lock you out for sometimes 45 to 60 days. And then who knows if the government shuts down or whatever else. And now there's a delay. So go ahead and be proactive, set up a My Social Security account, and then it'll be very easy for us to help you apply for A or apply for A and B, or help you apply for B later down the road. That's another biggie. Why I always recommend. There's a million reasons why you should take A no matter what, unless you have a health savings account. But one of them is that it's very easy to help to enroll into Part B later down the road if you have A in place. Anybody confused yet? Anybody? Nobody? How about this? Let's break it up. Let's do a little Let's do a little spin. Spin the wheel. Let's see if anybody wants to win some money. This is fun. This little wheel thing. All right, Tom won the first time. Let's spin one more time.
Hey, while we
Who's the
wait on that,
next?
I'll answer a
Yeah.
quick question. Kimberly, unfortunately, if you wait till 70 to move to Medicare, your Part B is going to still be the same. Actually, Part B may rise, but not due to your age, just due to inflation and all those factors. So waiting, postponing Medicare Part B is not going to really benefit you.
Mark Olivero. I hope I got it right. Mark, you are a winner. All right, we're going to get you a $25 gift card to a tasty restaurant. Good job, Mark. Let's go ahead and spin one more. Let's give away one more. This thing is fun. I like spinning this wheel. Let's just have a little game show the rest of the time. Forget the webinar. Who's the next contestant on the $25 gift card wheel? There's some serious Dennis Grant. Kim, are you logging these? And by the way, um, we are only giving these away to people who are actually attending or in here right now participating. We did not have a terms and conditions, but I just made those up. If somebody signed up and didn't come, I'm not going to send them a $25. So we have the log here of who actually showed up. But cool. Thank you for playing, and we'll get back to that game here in just a moment. Let me get back to the PowerPoint.
I think you missed your calling with this wheel.
I think I'm gonna start a game show, Brett, one day. All right, can you see this? Brett, you good? Okay. So how should you enroll? Let us do it for you or help you with it through the Social Security Administration if you don't have Medicare. And I'm sorry, if you're not drawing Social Security, you'll apply through the Social Security Administration. And but if you are drawing Social Security, they're automatically going to enroll you into Part A and B, so you're good to go. Anne McManus, if I said that right, has a question. Can you put it in the chat, Anne, and Brett might be able to answer it, or I might touch on it here in just a moment. I do like that hand raising feature. I want to get through this just because I don't know if these other folks are at work trying to be sneaky watching this thing, or they've got like a pickleball tournament to get to, or what, or their favorite show comes on at 3. So I'm going to try to get through it, and then we'll answer as many questions as you want. All right, what is not covered by Medicare? Original Medicare does not include dental, vision, and hearing, gym memberships, prescription coverage. Part D, prescription coverage is not included. You have to get this separate prescription drug plan or you could be penalized. And these penalties are lifetime. So very important that you check these boxes when you're approaching Medicare eligibility. And then long-term care is something that most people don't have in place, forget about, or just kind of don't start shopping it till it's too late. We have plenty of resources to help you with that as well. So if you have any questions around that, definitely let us know. But I'll show you some ways that you can get some of these things included in one of the options that you go with: Medicare Supplement, Medicare Advantage. Speaking of which, okay, remember at the beginning I said there are 2 main options. Option 1, Medicare Supplement. Option 2, Medicare Advantage. That's really what I want you to keep in the back. Just keep that in your head. There's only 2. When you start thinking of all the different letters and all the different things, it gets even more overwhelming. But if you just think I'm either going Medicare Supplement option 1 or Medicare Advantage option 2, I promise you it'll make it'll help you keep your sanity, I think. Or you can just not listen to a thing that I'm saying and schedule an appointment, turn your brain off, and let us do it all for you. That's also an option. So that could be option 3. Turn your brain off. Option 3. No, okay. So option 1, Medicare Supplement. Medicare Supplement is a true secondary option. It supplements what Medicare Part A and Part B doesn't cover. Okay. So I'm gonna get back to the Part A and Part B in a moment. It'll make more sense. But with a Medicare supplement, you do have to pay a monthly premium. And we put on here some guesstimates because based on your state, Georgia and South Carolina has a little bit cheaper rates than Georgia. We kind of averaged these together, I think Brett did. But for a female, about $135 a month, and for a male, around $155 for a Medicare supplement. The most popular supplement is a Plan G supplement. Probably today, if I were getting onto Medicare, I'd go with a Plan G. Full disclosure, and is Colin, you said Colin was out today, but my mom, I'm like almost positive went Plan G. Okay. Isn't that sad? You're like, you don't even know what your mom got? I know she went supplement. I don't know if she went G or N. I'm almost positive she went
He went
G.
Plan
But
G.
okay. That should say something though, how much I trust my team that I was like, hey, look, talk to Colin, talk to Brett. Brett will tee you up with somebody in there. Really, honestly, I was had confidence in every single person on our team. So that's good. Kudos to us and to my mom for trusting. Anyway, Plan G supplement. So no matter which option you go, Plan A, Medicare supplement or Medicare Advantage, you have to have Part A and Part B. Keep that in mind. So you're going to have to pay that Part B. I don't, it keeps not allowing me to click back. You got to pay that Part B premium. Remember, it's $202.90. Okay. Part A is free. You don't pay anything a month. Part B, $202 a month. And now we're looking at a supplement Plan G, which you're going to have to pay that additional $135, $155. Now, how does that work? What does the Medicare supplement give you? Well, if you have the Plan G supplement, it will eliminate everything that Part A doesn't cover. So essentially, you will have no hospital bills if you have Part A and B and this supplement Plan G, this Medicare supplement. It covers everything that Part A doesn't cover. Remember, I told you take it with a grain of salt. All of this stuff down here, the $1,700 deductible, you won't have to worry about that. The Plan G supplement eliminates all of it. Now, so it's pretty cut and dry, easy peasy. Now, when you go to the doctor, you will have to meet the $283 deductible for Part B. Okay, so we go back to Part B. Remember, you have this $283 deductible. Once you meet the deductible with just original Part B, then that's when Medicare would kick in and cover 80%, but it would leave you responsible for 20%. But if you have a supplement plan G, once you meet the deductible, then original Medicare Part B covers 80%, and the Plan G, excuse me, the Plan G supplement covers the remaining 20. Let me take a sip of water here. I don't know what in the world. It's like a crouton just flew out of my tooth or something from I had a healthy salad for lunch. Oh, okay. So Plan G supplement, it eliminates all your hospital costs, leaving you the only thing you have to worry about cost wise is paying your monthly premiums. And then the 20% is covered by, I'm sorry, you have to, your premiums and the deductible is all you have to worry about if you have a supplement. That Plan G is going to cover all out of pocket after the deductible. Have I confused anyone yet? When I start stuttering and fumbling my words, I'm like, oh gosh, I know that if they weren't confused before, they probably are now. So pretty cut and dry. Plan G supplement, you pay a premium and it knocks out the hospital bills and picks up everything at the doctor after the deductible. As long as Medicare will pay, then the supplement is required by law to pick up that remainder. Okay, is some foreign travel benefits, $50,000 lifetime, and it's an 80-20 rule. So it has to be in case in an emergency situation. If you have more questions about that, we can dive in deeper. I'm going to briefly cover Plan N. These are becoming more popular. You can see that the premiums are a little lower, $100 for a female, $120 for a male. They do the exact same thing when it comes to hospital. Plan N will eliminate all the hospital costs, just like a Plan G. But the difference is when you go to the doctor, after no matter whether you've met the deductible, okay, excuse me, you still have a deductible. You still have to meet the $283 deductible on a Plan N. But even after you meet the deductible, you will have a up to a $20 copay at every doctor appointment. Okay. And if you went to the emergency room, you'd have a $50 copay. So you have these extra copays. And then there's this sneaky little guy called excess charges, which is kind of hard to explain. And I'm going to try to do a good job of it right here. So excess charges is when a doctor charges more than the Medicare allowable amount, then you could get hit with like 15% of those charges. I'm not going to dive too much into this because I think the statistics say there's only like 2% of doctors in the country right now charge excess charges. I just want you to be aware of it. There is something that could happen in the future. And with the way that the healthcare system and the government and everything else, who knows what could happen in the future if doctors start to charge more these excess charges. So just something to be aware of. I don't know that we've ever had a single client get hit with an excess charge. But then again, a lot of our clients are on Plan G. So we don't have a huge sample size on Plan N, even though we have probably a few hundred clients on Plan N, if not more than that. Okay, let's keep going. Here are some pros and cons to Medicare supplement. Kim, thank you for updating that slide. We did have it did say advantages and disadvantages, which just gets all confusing when you're talking about Medicare Advantage and Medicare supplement. And that was unnecessary for me to even say because it might have confused you even more there. But I wanted to give a shout out to Kim. Thank you, Kim, for putting this together for us. Medicare supplement, pros and cons. The pros, there are no doctor networks. You don't have to worry about doctor networks at all. Doctors love to take Medicare supplements because it's much easier for them to bill. As long as Medicare will pay, then the supplement's required to mirror that. So if Medicare will pay its 80%, supplement has to pay 20%. It kind of has to follow it. So you don't have to worry about doctor networks. As long as they take Medicare, you're good. I already said easy billing, no claims issues. That's why doctors will always say, oh, yeah, you need to go Medicare supplement. Well, a lot of it has to do with it makes their job easier. Not so much. Again, I'm going to discuss these two options. I do not think one's better than the other. I can make a case for Medicare Advantage and I can make a case for Medicare supplement. It depends on your health and your finances. So just because my mom went Medicare supplement doesn't mean that I think that's the best option for everyone. Pretty sure my dad went Medicare Advantage. So just kind of depends. All right, travel. Yeah, you can travel with the Medicare supplement because Medicare's federal. And again, no doctor network. So as long as the doctor out in Oklahoma takes Medicare, supplement's going to follow right along. Now, this is huge. Whenever you are turning 65, you have this window where you will not have any underwriting. So Medicare supplements do not require any underwriting. Everyone will get approved when you turn 65. without health questions, as long as you're in that window. You have like 6 months after you turn 65 to enroll into a supplement, and you don't have to worry about any pre-existing conditions. So if you do have any, just keep that in mind. This is a very important window. You don't want to miss that window if you do want to go supplement, you want to enroll, especially if you have any health conditions, pre-existing conditions, you want to enroll during that 6 month window. Cons. Okay, what are some downsides or things to be aware of? Medicare supplement premiums can increase. They don't always, but we've seen it over the past few years that they can increase. Going with the cheapest premium option is not always the best move, even though we do shop these supplements more on kind of which one will save you the most money. But I don't want to get too much in the weeds here, but there are different blocks of business. And if you have a company that just has a super low rate and they're just getting everyone in there, well, there's a higher chance that there could be some health issues, or if they're approving people through underwriting, very lenient underwriting, that could increase the premiums in the near future. I don't know that I even should have brought that up. I'm not trying to, I probably could just confuse you there. Just know that premiums could go up, and they most likely will, probably around 8% a year is probably what you're looking at. It's a good guesstimate. Prescription drug coverage is not included in a Medicare supplement, so you have to get a separate Part D plan. The national average right now is about $40 for a prescription drug plan, and you have to get one even if you're not taking medications, because if you do not enroll into a prescription drug plan and then eventually you do enroll into one, you will have a lifetime penalty per month. So got to make sure we get you a prescription drug plan. Dental, vision, and hearing benefits are not included in a Medicare supplement either. So you'd have to buy that plan separate. Just some things to be aware of. Brett, do you I know you're typing away. You're like keyboard warrior over there, and that's fine. I'll keep on flowing unless you
Yeah, a couple
wanted to say
questions
something.
we've had that are looks like I've gotten to most people, but
I'm
Medicare
gonna let you
supplement
take
premiums.
I'm gonna let you take that. I'm gonna go turn my heat up because for some reason it just like a
Good.
wave of
Take your break.
freezing just hit me. I'll be right
I
back.
can probably hit a couple questions really quick. One question that a couple people are private chatting and put in here. Supplemental premiums, they do rise. They're all going to rise. Okay, there's not a supplemental premium out there that is we could put you on and say, hey, set it, forget it. It's never going to go up. The premiums will rise based on numerous factors. Typically, cost of living, our regions play a big role into that. Age, inflation, all of those factor in. The cost payout ratios that carrier is paid out for that giving pool of the given pool of business. And so when we shop supplemental rates, we want to find a carrier that has a obviously great brand recognition, who's been around for the long haul, but who's not only going to come in at a competitive rate, but who's going to maintain that competitive rate over the competition. Because when we get you a supplemental policy, when you're new to Medicare, you could come to us with terminal cancer, heart attack, stroke. When you're new to Medicare, even if you work till you're 70 and delayed Part B of Medicare, you're still new to Medicare in the government's eyes. You cannot be denied based on health history. And so we take all of that into account when we shop supplemental. But depending on the particular supplement, there are various factors on how they do rise in premium, which we'll go over with you. But to answer your question as far as increases, Chip was right on the money. It's a very volatile market right now, but I threw a number out there nationally, probably around that 8% mark of fluctuation. May not go up every year. It's been a long time. I don't know the last time I've ever seen there, although there is instances where it goes down. Right now we're seeing, the market present increases more than decreases. So hopefully that answers that question.
Yeah, and great answer, Brett. And we're tapped in not to just pricing with these carriers. We know these carriers who their leadership is. We know the carriers that are, um, sometimes it can be a headache for us when we're trying to put someone through underwriting. Maybe they had a Medicare Advantage starting out, and then they say, you know what, I do want to get a supplement now, and they're 68 years old. We have to go through underwriting, and they may get denied. Well, with a certain company, well, those companies that are very strict on their underwriting, those are the companies that will help keep your rate down over your lifetime starting out. So just know that we are much more tapped into the market than just price. We can help you decide when it comes to that. All right, let's move on to option 2, Medicare Advantage, or Plan C, Part C. Medicare Advantage. This is the one you see all the commercials about, where they'll give you all the things: gym memberships, dental, vision, and hearing. They'll cut your grass. They'll give you a ride somewhere. I mean, heck, a lot of that stuff is true. They will give you a lot. Now, how does Medicare Advantage work? How much does it cost? Let's dive in. So, Medicare Advantage, remember how I told you Medicare Supplement is a secondary insurance? It supplements what Medicare Part A and Part B doesn't cover. Well, Medicare Advantage, or Part C, replaces your Medicare Part A and B. So essentially, the government says, hey, you're going to be A, B, and C. So the government gives these Medicare Advantage carriers an allotment of money and says, now United Healthcare or Humana or Aetna, you assume Miss Jones' risk. Okay. And so they kind of put it all together. The deal is with the government is that, hey, we'll let you take over the Medicare side, and we'll give you this bucket of money, United Healthcare, Humana, whoever, but you have to give at least as good of coverage as what original Medicare gives. And they do. And I'll show you some of the features here. So many Medicare Advantage plans have a $0 premium option. So you're not paying anything additional to have this plan. Keep in mind that you do have to have Part A and Part B. So, which means you have to continue to pay your Part B premium, that $203.90. $202.90. I'm going to get this right. We're still fresh on this. I'm going to say $203, so I don't have to say 202.90. It's like a paragraph. So you do have to pay your Part B premium, and then you can get this Medicare Advantage plan. Many of them have $0 premium options. And what's good about them is most of these Medicare Advantage plans eliminate that deductible, that Part B deductible. Remember, I said before, you have to pay the $283 before Medicare Part B kicks in. Well, that Medicare Advantage plan is replacing Part B and replacing Part A. So they're coming up with their own rules on how they're going to handle hospital or how they're going to handle the doctor's office. So you can basically take all of this out of the equation. A and B, just forget about that. Just know that you have to have it. This would be the big piece that you'd need to remember if you're going Medicare Advantage, that you have a premium for Part B, but you predictable copayments. That's what I was getting at. So Medicare Advantage plans have this, always reference like a Waffle House menu. Okay. You go to the Waffle House menu, it's got all the things on it, and it tells you exactly how much they cost, obviously. And the same thing happens with a Medicare Advantage plan. They may have primary care physician, PCP, $5, specialist, $30, hospital, $350 a day for days 1 through 7, MRI, $280. This is just an example, but these are numbers that we see, rough estimates for some of these items. So it is nice to know that you're walking in saying, "Oh, I'm going to have a CT scan." Well, I know that's $280, so I can do it. Whereas if you just had original Medicare and I'm not saying original Medicare with a supplement, just original Medicare. Remember, Part B, you would have had to pay 20% of whatever that cost was, and 20% of a lot could be a lot. And that's why I keep going back to there are two options really: Medicare supplement or Medicare Advantage. I really don't know anyone that just has Part A and B only because it just doesn't make sense, especially with a Medicare Advantage plan that doesn't cost you anything and can eliminate deductibles, give you predictable copayments so you know exactly what you're going to pay. And many of these Medicare Advantage plans include Part D, prescription drug coverage. Okay. Remember, I said if you don't have prescription drug coverage, you could be penalized, and it's a lifetime penalty. Well, most of these Medicare Advantage plans have a prescription drug portion built in. So it checks that box. You don't have to pay extra for it, and you will avoid the penalty. Many of the Medicare Advantage plans have dental, vision, and hearing benefits included, over the counter benefits, gym memberships, and this is a biggie: max out of pockets. With original Medicare, there is no max. You could 20% of a million is 200,000, right? But with Medicare Advantage, they Brett, we do this every single webinar. There is a max that it was like 9,600. Heck, I did a video on it. It's on our website, Brett. If you look at that little screenshot of the video that I made, I think it's 9,600, but we're going to fact check that. But having a max out of pocket is huge because, for obvious reasons, there is a max that you could hit. The most you could pay in a year if everything went wrong is this number. And most of the Medicare Advantage plans have them around the $7,000, $8,000 mark, but they're very hard to hit. Brett, you're nodding your head. Did you find it?
Yeah, I'm sorry. I was distracted here. It's 92.50 this year. 92.50.
9250, even lower. 9250.
Yeah.
Okay, so but every plan is different. They can build it how they want. Some may give extra dental, but have higher copays at the doctor, so they can build these however they want to. But it's very hard to hit the max out of pocket, and I'll tell you why. But if you look at this also, and I'm sorry I'm scattered all over the place, but outpatient surgery with the Medicare Advantage, having that predictable copayment, that's huge. $400 for a outpatient surgery is really a really good price. If you go have a total knee operation for $400, that's crazy. That's really good. Whereas if you just had original Medicare, 20% would be way more than that. But it's very hard to hit the max out of pocket to even come close to this number because of the way that most Medicare Advantage plans are built. The hospital copay, $350 a day for days 1 through 7 is what we put in this example. That means if you were to go to the hospital for 1 day, you pay $350. 2 days, $700, and so forth. And so you would have to go, even if you went for 7 days, or if you were in for a month, you would only pay for the first 7 days. And do the math for me, Brett. There, help me. 7 times 3 is 2,100 and 350, 2,450. Is that right? 2,450. So 2,450. If you went in for 2 weeks, you would only pay for the first 7 days, and that's 350 times 7 is $2,450. So you'd have to go into the hospital multiple times to hit that 7,600, or have a ton of MRIs. It's just really hard. Most of the time you go to the hospital for a day or two and they want to get you out of there. So you're not even in there for that long. All right, let's keep going. Let's keep this moving. What are some disadvantages to the Medicare Advantage plan? This is a screenshot from one of our goofy commercials. I don't know if you guys have ever seen our commercials, our U64.com. Anyway, you should check them out if you haven't seen them. Doctor networks. Okay, so what are some disadvantages to Medicare Advantage plans? There are doctor networks that you need to be aware of. They're getting better and better. It's not something that we run into a ton. Um, I guess what I'm trying to say is it is not hard for us to find a plan that has all of your doctors in it. So don't stress out about that. We should easily be able to find one for you. Claims and authorizations. This is something that you could run into if you've ever had a surgery. Uh, when you're pre 65. So in the past, ever in your life, if you needed to have a surgery but you needed a prior authorization, well, these are insurance companies that are administering these Medicare Advantage plans. So, of course, they want to get it authorized. They want to make sure that you actually need the surgery, and they want to see, hey, have you tried rehab first? Have you tried medications? They don't want to go spend all the money, go straight to the big ticket surgery item if they can avoid it. So that is something you can run into. We don't see a ton of pushback, but it's definitely something to look out for. Referrals, you may need a referral if you have an HMO plan. When you get into the Medicare Advantage world, there are HMOs and PPOs. Not going to dive too deep into that, but HMOs, where it's a pretty strict network. PPOs, more of an open network. Typically, you'll save more money on an HMO, but you're kind of constrained to a network that could require referrals. Service areas, all I'm really saying, meaning by this, is Medicare Advantage plans are very regional. So they're it's harder to travel with the Medicare Advantage plan. If you are traveling, then you can always go to the hospital in an emergency situation. But it's going to be harder for you to travel, and then I don't know who travels across the country and then goes and sees a cardiologist while you're on vacation. But I do understand that people move during their lifetime and may have that doctor they like to go see once a year also. So that that may be a situation where you'd either want to go Medicare supplement or go with a PPO that has a little more flexibility within the Medicare Advantage. Okay, we're cruising right along. I always use this example. If when I go to buy a car, which I haven't done in a long time, 2019, my car is falling apart. So it's probably time, but I can't stand going because I don't trust. And nothing against the car salesman out there. I just don't know. You don't know what the price is. What's that? What's that car shop or whatever? There's one that does. They don't negotiate. What's it called? Brett, there's one over on like Abercorn.
I know who
It's
you're
not
talking about.
Carvana. I can't think of it.
CarMax. Car.
CarMax. Like they do not negotiate. And there's something I kind of like about that. It's like, okay, well, the price is the price. But in everywhere else, it's like, no, there's something built in. Anyway, what I'm trying, tax tag and title is what I'm trying to help you when you sit down at the dinner table tonight and you're like, I got on the webinar with this crazy guy and he was telling me all this stuff and had my head spinning. And then whoever your spouse, whoever you're eating with says, well, what is the price? And he's like, I don't know. I'm trying to give it to you right here. I'm going to try to add it all up if you went option one or option two, just to give you a number you can think of in your head. So Medicare supplement option one. Remember, part A, you've earned it. You work 10 years of your life, so you don't pay anything a month for part A. Part B, this is your doctor's office portion of Medicare. You're going to pay $203 a month for Part B. The Plan G supplement, remember this is a Medicare supplement, will cost you about 135 to 155 bucks a month. And prescription drug plan, we need to update that, Brett, to like right around $40 a month, probably national average. There are some that are zero, some that are 150. So, I know I'm trying to give you a out the door tax tag and title price here, and I'm not factoring in whether it's we upgraded to leather or not. So, but still, this is going to be a good rough estimate. Dental, vision, and hearing on a Medicare supplement, if you were going to add that, let's say it's about $50, you're really looking at around $400 for a Medicare supplement. 400 to 450. But just keep this in mind. You're paying that a month, but remember, you will not have a hospital bill. And the most you'll pay at the doctor is that $283 deductible. After you pay the 283, then you're done. So yeah, you pay a little bit more up front, but you don't have to worry about bills or doctor networks or any of that stuff. So peace of mind, especially if you have any medical issues, man, it could be it really could save you a ton of money. So supplements are a great option. Looking at around 400 to 450 bucks a month. Medicare Advantage. Remember, Part A, $0. You don't pay anything a month for it. Part B, you still have to have it, $203. Most of the Medicare Advantage plans cost you $0 a month, and most of them include Part D, the prescription drug portion, so you don't have to buy that extra part. Most of them include dental, vision, and hearing benefits, so you don't have to pay anything extra there. So if you were to just say, hey, I just want the core Medicare Advantage plan, you're looking at about $203 a month to have a Medicare Advantage plan. Now, something that we highly recommend that you get, especially when you're turning 65, is something called a hospital indemnity plan. And essentially, for about 40 bucks a month, you can eliminate that hospital cost. So remember how I said that the Medicare Advantage plans build their hospital copays a little differently. It may be days 1 through 5. They'll charge only for days 1 through 5, and they'll charge you $400 a day for the first 5 days in the hospital. Well, we can build a hospital indemnity plan that will actually, let me go back to that, eliminate that cost. We will build it to match your Medicare Advantage plan. And when I say eliminate, they will actually write you a check. If you go into the hospital for one day, in this scenario, it's $350 a day. So if we built you a plan to match that and you went into the hospital for one day, the hospital indemnity plan will write you a check for $350, essentially wiping it out. So I think our customers have loved it. You know, it's pretty affordable, and getting it when you turn 65, there's no health questions asked either. So that's huge. Also, another piece that that we suggest is a cancer policy, because back to that max out of pocket on the Medicare Advantage plans. Remember how I said it's very hard to hit this number? Well, one way that we do see people hit the max is if you need chemotherapy. So a very easy way to hit the max is if you need chemotherapy. And obviously, if you were diagnosed with cancer. So if we were to build you a cancer policy to match the max out of pocket, in this instance, we'd probably write you a $8,000 or $10,000 cancer policy. Very affordable, probably like 20, 25 bucks a month. Brett, am I off there? So he's nodding his head yes.
Probably a
So
little higher, depending on tailoring it, mirroring it to a plan and so forth.
yeah, so the difference between kind of 8,000 and 10,000, but in that range of about 25 bucks a month, you can get a cancer policy that will, heaven forbid you get diagnosed with cancer, they would write you a check for that amount, and then you could pay your bills and or have some extra money to travel, or if you're out of, when I say travel, I mean sometimes you need to travel for chemo or for your treatments, and that can help with your hotel stay or travel accommodations, and if you had to miss work. So they're all things that you hope we never have to use, but if it ever comes, if that day ever does come, that at least you're covered. So tax tag and title out the door. Medicare supplement about $400, 450, and then Medicare Advantage you're looking at about 200 to 250, depending on if you want to add some bells and whistles to it. Are you a veteran? If you are, thank you for your service. Thank you very much. This gets tricky. And so I'm going to give you just a quick bullet point on it, and then I'm going to tell you to schedule with us. And then we'll try to answer some of your questions at the end on this piece as well. So um, if you're a veteran, you have access to certain options that civilians, I don't know what do we call it? Is that an accurate description there, Brett? The civilians. If 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 you're a veteran, then you have access to things that non-veterans do not. So if you're on TRICARE, then most likely you do want to enroll into Part A and B, and that would turn into TRICARE for life. If you use the VA for your health insurance, you don't have to take Part B. There's a ton of scenarios here, but I'll say this: if you are a veteran and you enroll into Part A and B, there are some options, especially if you have access to prescription drug coverage. That's where I was trying to get to here. If you have access to prescription drug coverage through one of these entities, then you may want to consider getting a Medicare Advantage plan that kind of incorporates this as well, because a lot of them will reimburse you or give you money back on your Part B premium. I probably did a terrible job of explaining that right there, but just know you still can get a Medicare Advantage plan. You just want to be cautious. If you go through us, I know we'll do a good job. If you were to go do this on your own, don't just dive right to it. Make sure that they're checking your doctor networks. That's where you can get tripped up. Your doctor networks are the biggest piece of it. And again, we'll dive into that more at the end here. The Inflation Reduction Act, we need to update this too, Brett, because it's changed. So $2,100 is the max that you can pay for your prescriptions in 2026. That's the most money you can pay out of pocket as long as your prescriptions are on the formulary. 2,100, and this was all kind of brought. This went into effect in 2025. The Inflation Reduction Act was passed back in 2022. It went into effect January 1st, 2025. It eliminated the donut hole, which you guys shouldn't care about because it's done. I'm not going to teach you about something that doesn't matter anymore, even though it kind of was a nightmare, a little bit of a headache for a lot of folks in the past. What you should take away from this Inflation Reduction Act is the max you could pay in a year is $2,100 for your drugs. And I'm not going to dive into the deductible phase and all this because it can just overwhelm you and confuse you. Most you can pay is $2,100 for your drugs, and you can set up payment plans for, instead of in the beginning of the year, if you have a deductible on your prescription drug plan, sometimes that can be overwhelming or could be a huge cost that people can't fit into their budget. So the Inflation Reduction Act actually made it where you had even monthly installments, which I think are $175. So it breaks that 2,100 up into 12 even payments. So you can pay 175 a month instead of paying that 2,100, early, all in just a 1 or 2 month span if you did have really expensive medications. Hope I explained that decent there. And all right, so what's next? As soon as I cover this slide, I'm going to spin the wheel and then we're going to answer some questions. Okay. So what's next? I suggest or recommend or request or hope that you schedule an appointment with us. You can schedule through the QR code, and I think Columbia's scheduling link is not on there in Albemarle, but we'll get those added. And you can also email us any questions that you have at, can you put this in the chat for me, Brett, please? Team at ru64.com. Any questions that you have about anything, scheduling, whatever you whatever you need, email us, team at ru64.com. Brett's putting it in the chat right now. But schedule an appointment with us. What'll happen during the appointment? We will help you decide whether you should even move to Medicare. It may make sense for you to stay on your employer coverage. We will shoot you straight. We'll tell you that. But if it does make sense for you to move to Medicare, we'll help you apply for Medicare. And once we've helped you apply, then you have Medicare Part A and Part B. Well, then we need to choose a plan. And remember, I said there are two options, Medicare Advantage or Medicare Supplement. And you can see that I tried to confuse you here because there really is a third option. It's just one that no one goes with, and we wouldn't recommend unless it was a very unique situation. But that third option being you go with original Medicare A and B and just get a prescription drug plan. Odds are you are not going to go with that one. You're going to go with either Medicare Supplement with a Part D or a Medicare Advantage plan. And so we hope you schedule. We hope that you let us review everything. We have a dedicated customer support line. You will have a number that you can text 24/7. I'm not going to say that we're going to respond 24/7, but our entire team is monitoring this, and you'd be surprised. Brett's a workaholic, and he enjoys watching the real Wheel of Fortune at night and probably answering a lot of your questions. So you've got dedicated support. We have a team of folks who are ready to help. You're going to want to review your coverage every year. And hopefully we can keep you on the same plan because we don't want you flip-flopping all the time. You don't want to do that either. It starts to get confusing. But we will get out in front of things. We can see them coming before and say, hey, you might want to switch to this plan this year. You may have new doctors, new prescriptions. And again, if you just call the insurance carrier, they're going to tell you to stay put. They're not going to recommend another company, and which is something that we would do for you if it makes sense. Lifetime concierge service. We pride ourselves on taking care of our customers. We know that you guys keep our business running, and yeah, we'd love to work with you. We appreciate you joining us today, and we just want you to enjoy your retirement. And I promise you, we will take this all off your plate as long as you're on our radar, as long as you're under our umbrella. We will not let you slip through the cracks. We will not let you get penalties. I promise you. All you have to do is schedule an appointment, and we've got you. But thank you so much for joining us. And I know we have a few questions. Ann McManus and someone else has their hand raised. So I guess we will open the floor to some questions. Brett, do you want to let folks, do you
Yeah,
want
I've
to approve?
got a few questions that were directed
All right, Brett,
that I could touch on.
I'll let you kind of touch on answer the questions in the text, and then we can unmute folks' microphones. And but first, I want to spin the wheel. I just promised I'd spin the wheel for him.
Spin the wheel. I've got a couple things I
Spin
can
the
touch
wheel.
on once we do that, and maybe answer a few questions at once with this.
Yeah, go ahead and answer
I'm too
away.
poor to retire. I know, Kara. It's not even in my vocabulary yet. And that's why it's hard for anybody to say everybody needs to go supplemental. Everyone needs to do this Medicare plan or this. We all are in different, financial situations, and it's easy for everybody to say this is what everyone needs to have, and that's not the case. You can't look at it that way, and it's not cookie cutter. But there is something for everyone, depending on it doesn't matter where you are financially, and moving to Medicare.
Lisa
Lisa,
Butterworth.
Lisa, I'm gonna
Lisa,
write that
come
down
on
too.
down. You're the
Lisa.
next winner. $25. Let's spend one more time. One more 25. Can I go to dinner with you guys? I it'd be a lot. Papa Smurf. That was my test. That was my test when I created the webinar. I put Papa Smurf in there. It's pretty funny. That would have been
And
funny if
Kara,
Papa
I
Smurf
think,
won.
and I see a couple of people talking about it. I think I can weigh in a little bit more on that when this wheel's done here.
I'm gonna stop. Wayne Russell, you're a winner. $25. Can you jot that down, Kim? And I'm gonna stop spinning the wheel for a moment. I'll probably spin it one more time before we get out of here. But anyway, I'm gonna stop sharing and let Brett answer some questions.
Margaret just hit us with a good one, so I'll touch on that one. If
Okay.
you already have Part A and you're still employed, how long after you retire do you apply for Part B and then Part D, which would be drug coverage? Great question. That may appeal to a lot of you guys. So I would assume Margaret has creditable coverage. Creditable meaning she has, through her active employment or her spouses, there's over 20 employees. So she just took premium free Part A. So what I would tell you, Margaret, is 3 months before your retirement date is a pretty good timeline. 3 months prior, you would want to reach out to us. And what we would do is submit for your Part B, the medical portion of your Medicare. Submit, it's just two small documents. We would submit the Social Security, a Part B enrollment form, and then the other one is just an employer request form, which shows you had proof of prior coverage. And it would give us ample time to move you fully over to Medicare on the date of your choosing. Part D, drug coverage, would come in a line right in there with that same timeline. Whether we went supplemental, Medicare Advantage, no matter what that is. Um, One question that always comes up, and had a few people ask, supplemental. No health questions asked when you get supplemental, we said, right? And a lot of you have asked, do we shop those every year? And that's a tough question. Can we shop them every year? Certainly. We can shop supplemental anytime we want. But keep in mind, when you are new to Medicare with supplemental insurance, the insurance carriers must accept your liability. They cannot deny you based on your prior health history. And once you're in, you're in. We know the rates are going to go up and so forth. Maybe in 10 years, that rate has climbed higher than what we consider a competitive rate. And if we want to present you to a new carrier who's going to give us the same exact coverage, but for a decreased premium, by all means, we would want to do that. But you are subject to underwriting, which is health questions. Essentially, we present you to the carrier. The carrier pulls your medical history and they say, okay, we do want to assure you or we don't. If they don't, sometimes they can give you a substandard rate or they just say, we don't want to insure you. And then you stay put at that point. Or your other option would be moved to Medicare Advantage when that time comes. So we're constantly keeping an eye on that because rates do fluctuate. So do keep that in mind. One thing I always like to say is, it goes back to it's not cookie cutter, right? Everyone has different financial means, but it is a little easier, going supplemental, moving to Medicare Advantage based off of that, because if going to Medicare Advantage, there are no health questions asked moving during the open enrollment period, which is October 15th through December 7th. Just to touch on that. A few of you guys said, I can't retire. This is ridiculous. I got to pay all this money. Hey, I've been paying Medicare FICA for all these years. What the heck am I'm paying again? Unfortunately, your FICA and everything you're paying is going towards Part A, but not Part B. And so everyone's going to pay that premium. There are instances where if you fall below a certain level of income, that you can get assistance through the state and federal system to help pay for your Part B of Medicare, which is subsidized, or even for your some helps on prescription drug coverage. So keep that in mind. Those are all things we'll work with you and help you apply for those kind of things. And there are plans. Have to be very careful of what we can say on a call that's plan specific due to regulatory things. But there are plans that will put money back in to your pocket for Part B for those that maybe just say, hey, I can't pay that Part B premium. And so there are some unique offerings. I did have one question that's near and dear to my heart because I get this a lot, Chip, and I almost wasn't going to answer it because it's a touchy subject, but I'm going to hit it.
Okay.
I deal with a lot of doctors, nurses, everywhere from outpatient surgery to full trauma, you name it. We deal with them. I personally have been in the medical industry for quite a while before I was doing insurance. And there was a question, and a lot of people say, well, Medicare Advantage, don't ever do Medicare Advantage. I work at a hospital, and claims authorizations are a pain, and you can't see a doctor, and all this. There is not a one fit for everyone. Everyone's budget is different. Um, Doctors always want to have take good care of you, and obviously they want the most easiest claim process and authorization process that they can, and reimbursement structure. And I do understand that every coverage is a little different, but it is not cookie cutter. We have clients that walk in the door netting $12 million a year that do Medicare Advantage, and clients that can barely afford supplemental, but that's what they choose to do. And we are not here to push something on you as much as we are to educate you. And everyone's situation is different, and we will make sure that you understand the in and outs of it. So it's just that simple.
Yeah.
Got a lot of
Just
questions that
I
we
you
hit. Go ahead,
you
sir.
can you
I
look
can
through
just type
those
them.
because well, and no, I think it's good to say some of these too, but I think you just mentioned something that was I'm missed. I realized I missed a few things that I wanted to say. Brett hit on a very big point. Medicare supplement. If you're on the fence, I don't know which way to go. If you're on the fence and you have the means to go with Medicare supplement, I would start there because Medicare supplement, there's no health questions in the beginning, right? When you transition to Medicare, you're automatically approved, and essentially you won't have any cost if you go to the doctor or the hospital, right? And there were these studies done by, I think it's Stanford. Brett and I mess this up every time, or at least I do. I'm pretty sure it's Stanford. They did a study that showed that when people turn 65, they health people were diagnosed with all types of health. There was a huge spike in health diagnosis at 65. And it's not because when you turn 65, you all of a sudden become sick and anything like that. It's because no one could afford to go to the doctor prior to 65. But Medicare is more affordable than typical under 65 coverage. So what I'm trying to get to is go Medicare supplement at 65. Go get the full checkup. Say, check me for everything because it's not going to cost you much. All just that deductible, $283 deductible. And then heaven forbid they find something. Well, at least you're already on that supplement. They can't kick you off of it. So now you're good. Now, say something terrible happened, you're covered for all those bills going on forward. And it's much easier to switch to kind of downgrade. I hate to even say that to a Medicare Advantage plan, as Brett said. You can go to Medicare Advantage anytime, but trying to go from Medicare Advantage to Medicare Supplement, you have to pass underwriting. And if you've already been diagnosed with something that could be a knockout question, kind of stuck. So that's big. And then one other thing before I let you keep going, Brett, who said I can't afford? I think it was Kara said I can't afford to retire. Cost of living adjustment, COLA, this year, and Brett even told me before, he said, you may want to mention that, and I totally forgot to. 2.8% was the raise this year on Social Security. So they do give a raise each year. And yeah, so something to keep in mind. Average Social Security check's like $2,000 a month. So about a $60 a month raise you got this year. All right, Brett, what you got?
ACA coverage. Let's hit it. Those that are on Affordable Care Act coverage through Obamacare, if you will, that is not deemed creditable for Medicare. So if you're on that, that's your only coverage. I had somebody ask, "Hey, I'm on with my wife through the Affordable Care Act." When you turn Medicare eligible, you're going to want to transition over to Medicare. They'll rewrite the policy for the younger spouse under the Affordable Care Act coverage. But yes, you will want to transition to Medicare because any subsidies that you do have through this federal government that makes that even remotely inexpensive, you will lose upon turning 65 once they see that. And if they don't catch it right away, you can have to owe some of that money back. So typically, it's I would say almost 100% of the time you're going to want to transition to Medicare if that is your sole means of coverage. If it's not through um, active employer coverage. Are there
Brett.
any other plans you can get with Advantage or other than hospital and cancer? Of course, there are. Yes, there are. You can be reimbursed these days for just about anything you can imagine. There are plans that will reimburse you for your out of pocket costs for your prescriptions, heart attack, stroke, cancer, dementia, severe burns, what's called a critical illness policy. Um, and they're very, very reasonable. And when you're turning 65, you get preferred rates, and depending on your health, um, they're just great coverage. And so, yeah, they call them an indemnity plans, whether it's for cancer, heart attack, stroke, all of that. And we can
Umbrella.
certainly look in that umbrella policy. We can really tailor it to the plan and keep it very affordable as well.
Hey, Brett, can you? I want to confirm that I'm right on this. Let's see where it was. Lisa McNabb asked, I think her husband is contributing to an
Yeah,
HSA, but she
yeah,
is not.
that's always a tricky one. So, yeah, as long as Lisa, if you're not the subscriber and you're not actively contributing to your own health savings account, you're good to go. If you're the subscriber under HSA and you're contributing non-taxable funds, then no. But in your instance, you're perfectly fine. Your spouse can continue as such, you'll have no negative impact there. We have clients a lot of times they'll come to us that have been contributing to the health savings account and had Part A. They aren't going to come tear down your door and steal your house and kick you out on the lawn. I mean, but you do lose a 6% of the non-taxable fund contributions. You would lose some of that. So if you are, I would tell you to stop. But in your instance, he's a subscriber. He's contributing non-taxable funds for you and the family. You're good to go.
I see a good one, Brett. That I don't think you just answered this, but Patricia said, if you have prior employer coverage and don't take Part B at 65, can you get Part B later without penalty? Yes. Did you already answer that, Brett? Yeah, you
Yeah, I
can.
think I touched on.
So if you're saying, hey, you're still working and you're going to keep your employer coverage, if as long as you're keeping the employer coverage, yes, whenever as long as that coverage is creditable, then you can enroll into Part B at any time, really, on first day of the following month. It's very easy to do so. You just have to fill out an L564 form, verify that you were. Did you already say this, Brett? Did you just cover that? Okay, I thought you were smiling like, yeah, I just said all that.
No, I was
Still
just
was like,
thinking
oh,
if I'm watching the comments and I was just thinking, oh, I forgot to say something very important. Go ahead.
well, yeah, no. So as long as we can verify, the government can verify that you did have creditable coverage, then you're good. It's you can. What I like to think of it like this: as long as you have Part A and you have employer coverage, then you can go and quit anytime you want to. You can just, you know what, I'm done. I'll have Part B at the end of the month. I'll have Medicare. Health insurance drives the bus for so many people's employment, and you know, I don't know. I could go into that whole thing of what my thoughts are on that. But to answer your question, Patricia, I think asked that. Yeah, Patricia, you're fine. You're
And
good. Keep
she,
your employer covered.
yeah, and she asked, can you have both? Yes, you can have both, but this is where things get tricky. If you have creditable coverage over 20 employees, you're working, Patricia, and let's say you took A and B. I would typically tell you don't do that, right? Because you're paying for Part B of Medicare. One's got to be your primary. And because you're working, that insurance is your primary. Medicare would be your secondary. It would be extremely unique that I would have you on both because you'd be kind of double paying and double coverage. And it doesn't really make a whole lot of sense there.
Yeah, you don't
And
want
for
both.
somebody asked, and this is where I had this light that hit me like, gosh, I should have
Mm.
mentioned this, but a few of you asked about HSAs and the timeline around that. And I tried to type to everyone, and I was maybe kind of getting behind. But HSAs, if you're one of the few that are not going to you're contributing to a health savings account. You're going to continue working and everything. Just quit contributing to that health savings account 6 months prior to when you're going to retire and move to Medicare and when you're going to call us. And the reason that is because when you do finally apply for Part A, they'll retro it back 6 months. It's just a nuance that not a lot of people know. So if you're contributing actively and you're just going to postpone, don't take A or B, call me 6 months prior and we'll make sure we give you a good timeline. This is where things can get tricky because every situation is a little unique. I don't work, have no insurance, not officially retired yet. Will I have an issue getting Part B? That's a tricky question. Assuming you're not 65 yet, no issue whatsoever. You can have no coverage when you're turning 65 and no issue getting Part B, assuming you have the active work credits and everything to do so. I'm on a health plan with my employer and a high deductible plan. If I sign for a report, is it going to cover something for me? Oh, if I sign up for Part A, is going to cover. Good question. This is where Part A can only help you. Let's say you had a critical event in your life, you're admitted in the hospital, and you eat up that primary high deductible plan you're on. Let's say a coma, something major, and you exhaust your primary coverage. Part A can come in and really help you, and there's no downside to having it. So yes, by all means, I would take Part A of Medicare for that very reason, and for the skilled nursing benefits that it does provide.
Brett, where are you in the questions? I just want
I think we've gotten all of them except for are there any plans you can get with Advantage? We already did that one. Sorry. Do you have insurance companies that are good for long-term care coverage? Long-term care coverage, great question. Not included in Medicare, right? We're going to live a long, happy life. What do we do when we get later on in life? Well, long-term care, assuming you're going to go to some kind of nice, assisted living establishment, it can be very costly. What that does is allow for some funds to be utilized and grow until utilized later on in life. Long-term care coverage is what they call that. Whether it's long-term care or annuities, both can be utilized as long-term care. Give us a call. We can talk about it. I've got referral partners that do strictly long-term care, and even more and more utilized. They call hybrid pension options, essentially using annuities now to do the same thing. And both have tax advantages, growth opportunity, and kind of work as a pension. That's why they call them hybrid pensions. So give us a call. I can put you in the right direction there and give you all your options. I'm on a high deductible plan. I'm on a high deductible plan. Is there an advantage for me to sign up for Part A?
So Maya, I think if I'm saying your name right, I'm the question that you're asking, Brett. So if you're on that high deductible plan, most times folks are on a high deductible plan. They are contributing to an HSA. Are you contributing to an HSA account in addition to that? If so, that would mean that you would not want to. That's the only scenario where you would not want to take Part A, because you lose and Brett knows more about it's like you lose the tax advantage, and there possibly could be penalties depending on your plan administrator, if I'm saying that right. So you wouldn't want to do it, Maya, unless you want to stop contributing to the HSA. I will tell you this though, a little piece of advice. If you do continue to work and you're going to keep that plan and keep contributing to the HSA, make sure that you stop contributing to the HSA 6 months before you are going to transition to Medicare or retire or whatever. Yeah, whenever you want to go to Medicare, you need to stop contributing 6 months prior. And the reason is, whenever you go to apply for Part A, if you're past 65, they will retro it back 6 months. They can't go any further back they can't go prior to when your 65th birthday is, or that birthday month. But say you went a year with that employer plan and then applied for Medicare, it would go back 6 months is when your Part A date would start. So that 6 months would be subject to the penalties and tax implications and all the things. So be careful on
And
that.
another thing too, people always ask, what's going to happen to that money? I mean, heck, I have seen clients who companies just dump money in their HSA. You could have $50,000 in that HSA and move to Medicare. You can continue having the HSA, you just don't want to contribute. But when you move to Medicare, that money can be utilized for things like your Part B premiums, your out-of-pocket expenses, and so forth. So keep that in mind. And we'll do a cost benefit analysis for you to decide if it's right to move to Medicare or not, too. High deductible plans, high deductible plan at $10,000 is your deductible, and you're paying $400 a month for it. Well, I can make a pretty good argument to move you to Medicare. So those are the kind of things that I would say a nice 30-minute consultation by phone or in person, we can really outline that for you. But those monies are not going away. Um,
Michael, good question. And no, you're fine. You wouldn't have to wait till yeah, if you're saying, hey, I have seen like one instance where an employer gave some pushback on, and it was kind of ridiculous. We ended up getting it resolved. So no, you can move whenever you want to Medicare, and your employers has got to let you. I hate to speak in absolutes with anything, but yeah, we've got thousands of clients, and we've never had anybody, you know, stop someone from moving to Medicare
the
when they
time I've had
wanted
when
to.
I've ever dealt with that is that a lot of the smaller companies will they ever give you a hard time as to they want to know within 60 days of you turning 65 or becoming eligible. But they're typically, especially if you're turning 65, they're going to move you over to Medicare. But because they actually, not that you're a liability, but you're getting older, you're on their coverage, you're actually costing them more money. Most are most are pretty happy to get you moved over. Can we call for consultation? Absolutely, you can. That's 912. I'm gonna put it in here.
Put the
Three
eight
three
three
five
three. Put the 833-359-6464 number, Brett.
eight
Just
three
a
three
359-6464. So
six
yeah,
four.
absolutely. And I'll if you'd like to also, you can email team at ru64.com, or we'll put the scheduling link in here. Team at RU. What other questions
It
was
looks like we have one more. Kara. I'm sorry if I screwed that up. Talking about short-term disability, long-term disability. Should you continue paying those? If you're paying that through your employer coverage and you've got it, you may be getting a preferred rate. And it's just kind of case by case. Can you afford it? Is it in the budget? Sometimes you can convert that premium into something maybe that you're going to use that you consider, more value, I guess you would say. And so it becomes once again a cost benefit analysis of how's the policy written and that kind of thing.
all right? If you don't have another question, highly recommend, or I hope that you guys will schedule a consultation. And you can send us an email, team at ru64.com. I just put the email in there. There's a scheduling link that has most of our locations on that page. If not, send us an email or call the number, and our team will get you to the right spot. We can do in person, we can do over the phone. Oftentimes, I recommend over the phone first, just to get a lay of the land, and then we can get you in person to kind of get everything established. I will say this also. I'm gonna spin the wheel one last time because it's just fun to do, and I want some people to go have a couple of appetizers on us. But right now we're in this window where if you know anyone that's on Medicare right now, they may be able to make a change. There are certain circumstances that could enable you to make a change if you wanted to. Yeah, whether a plan was terminated or leaving a service area, or you're on a Medicare Advantage plan and are not satisfied with it, you can move back to original Medicare or look at other Medicare Advantage plans. So, yeah, if you know anybody that's on Medicare, we'd love to help them. And if they're, especially if they're not happy, or if they just don't have an agency or a brokerage like us, or didn't know that we existed, we'd love to help them. And let me spin that wheel if I can find it. Where is it? Okay. All right. Where's the wheel? All right, Wayne Russell, you can't win this time. Spin. I want Papa Smurf to win. Uh-oh. We're in the V's. Uh-oh, we're about to get to the A's. Is a who? Huh? Amber Lineberry, come on down. She is actually one of our employees. So I'm going to spin one more time. But Amber, we're still going to give you the gift card because you're awesome. If you call in, good chance you're going to talk to Amber, and she is awesome. One more time. I hope that everyone enjoyed the webinar. We're going to be doing another one next month. If we're going to send out probably a copy of this one as well. Jan Hudson,
Jan.
$25. 25 to Jan. Congrats. We're going to try to send out a recording of the webinar of this one here soon in the next week or so. We'll probably put it on the website. Again, you can visit our website, download our book, schedule an appointment. If you know anybody that you think might be interested in a webinar like this, we're going to be putting up our next webinar is going to be March 24th, and we'll have the link in there shortly. Please don't just share this just so people hop in to get a $25 gift card. I could see that happening. Like, hey, just hop in. What are you doing next March 24th? I'm going to win a Longhorn gift card at the Wheel of 64. Anyway, thank you guys for joining. And there's only 7 people left, I think, and they're probably all of our team members. But y'all have a great afternoon, and we hope to talk to you soon. Thank you.